Hey everyone, Dr. Paul here. Now a lot of people have asked me, how do we get the black background in our anterior shots? So in this video, I'm going to go over the things that you need, how to do it, and then some tips and tricks to get the shot that you're looking for. So when I used to see these photos like this on Facebook or Instagram, I used to think, wow, how do they do that? How do they get this black background? I did some digging. Turns out that it's literally just, you're taking a photo of the teeth, pull the lips away, and you're putting a piece of plastic or a bit of metal like this guy that's black in behind the teeth, and it gives you this black background. I felt like I'd been cheated almost, that I thought that it was some crazy technology that people are using, but there's really not much to it. So most of the time when you see that black background, what they're using is something called a dental contraster. Now these, you can buy them from reputable dental imaging companies, and they can go anywhere from $100 to $200 US. Now that's quite expensive for the average user for a piece of plastic. So the one that I've purchased is a metal one. I've got it from online. The downside to this one is that it does scratch a little bit easy, so you just got to be careful with it, but it does the job really, really well. Now I'm going to show you how to use this one, but I'm also going to give you some alternatives that you can use that are a little bit cheaper. So what I've got here is a piece of black cardboard, and this is going to act as the dental contraster. Now, the shape of the contraster, I'm really happy with, so we're just going to copy that. Essentially all we're going to do is we're going to trace around the outline. We're going to cut around that with some scissors, and that's going to give us our contraster. So this one here I've cut out and I've actually laminated it. This one you can actually cold stere, so you can reuse this one. The problem with this one is that it does give you a reflection. You'll see that when we take the photos. This one's only going to be single use, but it does actually produce a really good quality image. What I've done is I've just cut away the handle part just so you can get more pieces from the actual piece of cardboard. By the way, first I'm going to show you techniques that you can actually use to get this image directly from the patient. The other way is if you don't get any of these materials, you can actually still get that black background. You just have to do it on the computer, and I'm going to show you that as well. So the next thing that you're going to need is some retractors. Now these are to pull the cheeks and the lips away so you can see the teeth properly. Now the ones that I base mine off are these small retractors here. But what I actually do is I cut the edges off to give us something more like this. It'll make more sense when I show you how we actually use them. But this way, it actually keeps the bits of plastic out of the image. And I'll actually link you to a video on how to make these just above here. The other ones that are quite good are these metal retractors. The small ends are quite good for pulling away, and they don't get in the image much either, so you can't see them when you take the photo. Ones that I don't like are the large retractors. They're just a bit too big. They end up showing up in the image. Or these guys, these definitely get too much in the way. So try and get your hands on some of these. Okay, so the first one that we're going to use is the metal contraster. So the first thing that we'll do is get the patient to pop the retractors inside the cheeks. That's it. And you want them to lift actually up and out, so kind of towards the ears. That way, we can actually make sure that the cheeks or the lips aren't over the top of the teeth. Then we want to position it in place. When you position it, if you're looking from the front of the teeth, you can actually see that the black actually goes past all of the back teeth there. So then we actually get the camera in place, and Matt, if you can just lift up a little bit higher for me, that's perfect. A little bit higher on this right one here. Yep, that's good. So what I'm looking for is making sure that the retractors aren't actually over the top of the teeth, and then we take the shot. So this is how the photo looks, and then if we zoom in to simulate what a crop would look like, it would be like this. Now, if you're going to be doing lower, it's the same thing. Hey, just a thought while you're watching. If you're getting something out of the video, hit the like button or hit the subscribe button. It really helps me out a lot. You get the patient to switch over the retractors. And it's the exact opposite, so we're going to be pulling down and then flipping it upside down. We're going to position it like that. That's perfect. Make sure it's right from here. So same with the lower, this is the image that we get. Probably in reflection, what I should have done is pulled the cheeks down a little bit lower and possibly also angled the camera down a little bit lower just to get better vertical height of those teeth. Here's the laminated cardboard piece. So same sort of deal. So position this guy in place. So this will just give you an idea on what the actual shot's going to look like. Just lift this one a tiny bit higher. Yeah, that's perfect. All right, so same thing, and take the shot. With this one, I find that because we have a reflection, you may need to angle it slightly in a way. Actually, Matt, if you can open a little bit wider for me. Angle it in a way that you have captured enough of underneath that the actual reflection won't make a difference. And I'll show you that on the computer. So this is what the image looks like, and then if we zoom in to simulate what a crop would look like, it looks like that. Now the further you have that contraster in, the more you're going to see that reflection. So you've got to try and find a balance. Possibly I could have gone in a bit further. What I then did was I went into a program like Paint, and I just basically made everything black just to get rid of that reflection. I'm going to show you a way that's really, really easy to do that as well, specifically for this image. The other one that we have is the cardboard. This one's only going to be single use, of course, but the good thing with this is it actually does a really good job of making that black background. So just lifting up this right side again, yeah, that's perfect. So we position it in place just like we did with the others. This side a little bit, that's really good. And then line it up, and then we take the shot. So here is that image, and then if we zoom in to simulate what a crop would look like, it looks like this. Now if I'm going to be critical, I probably should have lifted the cheek retractors up a little bit higher, especially on that right hand side, but as you can see, it gives a really nice background. Okay, now that we've seen that, I'm going to show you how to get the same results by taking one particular image and also using your computer. Okay, so this is the shot that we're going to be doing where you don't need the actual photo contraster, so you get the patients to pop the retractors in again, and you get them to lift up and out. And so, move it again. So up and out, so making sure that you can actually see that we've got a lot of the gums that are actually, or the gum is exposed, and then, so you get them to open just a little bit, so that way you're actually differentiating between where the tooth finishes and ends, so it makes it easier for the cleanup process on the computer. So here's the image that we've produced, and the first thing you're going to do is transfer that to your computer and then open up the programs. Okay, so the first program that I'm going to use is Microsoft PowerPoint. So when you're in PowerPoint, you go to Insert and then Pictures, and then you choose the image, which is this guy here. So from there, what I like to do is crop the image, and I go to around the area that we're going to be actually needing. So we go to around here, and from there we click away, and then it will give us this spot. So we're then going to go to this option here. So under Format, it says Remove Background. Now it's actually going to try and do that, but normally it's going to do a pretty bad job of it. I'm just going to zoom in here. And what it's actually trying to do is link things that are together, or keep things that it thinks are similar. In this case, you can tell that it hasn't really done that very well. So what I want to do is say mark areas to keep. Now there's a little bit of tooth that's back here that I want to be able to see. So we scribble that. And then we're going to scribble this side as well, because we want to keep those teeth. And you notice that other bits also get selected, but that's okay. Don't worry about that at this stage. Let's just keep this in case we need that little bit. And then for the other areas, you're going to hit mark areas to remove. Now, because the patient here is open, we can actually differentiate between the teeth and the tongue and the other teeth. If the patient is closed together, because the teeth look similar top and bottom, it actually makes it hard for it to work out exactly where the top teeth start and finish. So it needs to be able to differentiate one thing from another thing, and having them open makes it easy. So we're going to go like this to say we want to get rid of all of that. And that's pretty much it. So from there, we're going to then say keep changes, and it's going to give us this. You want to right click and you say format picture. It'll open up this menu here. We go to we go to background, we hit solid fill, we then choose the color of black. We then go to crop. Sorry, click on the image again, you hit crop. You shrink this to the area that you like. So we're going to get rid of that retractor so we can't see that. We go like that. Click away, and then here is our image. Now, you zoom out, and what I like to do to keep the quality high when we export this, I normally make it the width of one slide. So go to there, we right click and say save as picture, and we save that one. So we hit save, we then go to the folder that we've saved it in, and this is what it spits out. So you can see the quality is actually quite good. So we're not actually using a black contrast in this case, we're doing it all from a computer, but it gives the effect that you want. A little bit kind of jaggedy along the edges, but it really does actually give quite a good effect. And you can zoom in, you can see the quality in the image is still there. So really nice way of doing it. Okay, so the next program that we're going to use is Adobe Photoshop Lightroom. Now, once you've imported your image into Lightroom, what I normally do, the first thing is I crop it. So it's the same thing, drag to the area that you're going to be needing. I always do it from the corners because you can do 2 lines with one drag. And then after you've done that, you hit done. Now we'll zoom in. Now, the tool that you're going to be using is the adjustment brush. So you hit this button here, or you can hit K. Now the settings that you need: exposure, drag it down to -4, blacks, -100, dehaze, -100, and the color, make sure that this slider is down to 0. Now the actual brush itself, how it works, is basically it gets rid of anything in that circle, or actually it makes it the color that we've chosen based on these settings. And that color is going to be black. So if you see I'm clicking here, it makes all of that black based on the size of my brush. Now I'm just going to hit undo. What we're going to use is auto mask. Auto mask basically is a feature where it will actually make black, or the color that we choose, anything that's similar, and keep anything that is dissimilar in that circle. So if I click here, you'll notice that it's everywhere is black except on the teeth, because the teeth weren't similar to what the tongue is. So if I click here again, you'll see that's what it does as you go along. Now, what I normally do is I'll use a size of brush that's a little bit smaller so I can be a bit more intricate, and then I zoom in, so you can click on the image here to zoom in, and we're going to go along the border like that. So I'll do a little bit and then I'll have a stop just in case I need to undo. Now, once you've done the majority, what I then do is I make my brush size slightly larger because I can do it a bit quicker. Then I go around again, so filling in those spots. If you're feeling a little bit brave, you can also take off auto mask. So when you take off auto mask, it'll just make everything black. Just be careful with this that you don't touch the teeth. So I'm going to go around the edges. Hit done, and there we are. And then let's export that image. So we'll say export. And then here is our image. So if we compare the two images that we've done, one from Microsoft PowerPoint, the other one from Lightroom, I think the quality from Lightroom is actually just much better. I think the quality of the image looks better. It's a little bit less jaggedy. However, a lot of people don't have access to Lightroom. So Microsoft PowerPoint is a good option if you need it. So a few little tips. If you are going to be using a computer, make sure the patient is open wide enough just to create some separation between the top and bottom teeth, just so it can differentiate between what's tooth and what's behind the teeth. Now the other tip is if you're using the contraster, make sure it's really, really clean. If there's any dust on the edge, although it's going to be small, it shows up when you blow the image up on the screen. Then you have to go into paint and you have to draw over the top of it. It's just easier to make sure this is really, really clean. The last thing is really making sure that the patient lifts those retractors up really high. If they don't lift them up high enough, the cheeks end up sitting over the top of the teeth, or you can actually see the retractors in the image as well. It just doesn't look as good. The more gum you can see, the more image you've actually got to play with. Anyway guys, thanks for watching. I hope you enjoyed the video. If you did, feel free to like, share, comment, subscribe, all of that sort of stuff. Have a great day, and remember, keep on smiling.